Thank you, Karen, for your introduction. Good morning, good afternoon, and good evening, everyone. As Karen introduced, I'm Sally, and I lead the MR-guided therapy product management team at Philips. Today, I'm very happy to see that many of you are here with us, because we all know the power of MR does not stop at delivering precision diagnosis to our customers, patients. Instead, MR can benefit many more by providing image guidance to enable accurate and personalized treatment. In the following 30 minutes, my team will walk you through the latest MR-guided therapy innovations in the space of radiotherapy, in neurosurgery, and also touch upon the urological and gynecological applications when combining with high-intensity focused ultrasound. Without further ado, well, now let me hand it over to the team, and I wish you enjoy the exciting program today. Now over to you, Romhill.
Thank you, Sally. So I will cover in the next couple of minutes the MR-RT simulation platform that we have, together with the synergies that we have with Elekta's Unity system. So the four things here on the slide we will cover, starting with the system itself, then the workflow, the planning and treatment position, MR simulation platform, and then the synergies with Elekta. Before going to the next slide, I just want to highlight the Ambition Blue Seal technology on the left. This is a technology that Philips has pioneered, where the level of helium is so low in the magnet that it cannot quench anymore. And because of that, you don't need a ventilation pipe for your installation at your hospital. This can be very beneficial for locations where you want to have your MR simulator, especially if it's down in the basement of a hospital. Then you don't need the potentially expensive installation costs for a vent pipe. With that technology, we as Philips are really focusing on environmentally friendly MR systems with less helium, but also it has many advantages for the siting of MR sim systems. We offer MR sim systems on our 70 centimeter bore systems like Ingenia, Elysian, Ambition, and Evolution. And I will then focus on the next things, which are the planning and treatment position. So let's have a look. What does the system look like? First of all, it's an 1.5T or 3 Tesla system where you can do the simulation on, and it's really meant for radiation therapy simulation. We do have a lot of innovation on our platform. Last year, we introduced the XD platform, which consists of a dedicated couch top, as you can see here on the image, which has a lot of advantages for the use for simulation and treatment position. Also, we have compressed sense, which is an acceleration technique which enables scans to be reduced by up to 50%. And the system can easily be used for both radiation therapy usage as well as radiology procedures, because the switch from one operation to the other one is really done in minutes. So it's ideal for shared use with radiology. We do see a lot of synergies with the Elekta Unity. I will talk about that later. And in the system also there is a lot on making sure that the patient is accurately positioned and simulated by having, for instance, automated geometric quality assurance, but also the optional lasers that can be installed for patient marking, as well as inherent high accuracy. So let's have a look at the system, how a setup is typically done. So here you see a patient being positioned on a RT system with some patient positioning in place, and the couch top can be used to enable scanning in the treatment position with the dedicated devices here. Patient is put down on the system at the right spot with the right indexing. There is the anterior coil support that's put to take the coil away from the patient, so there is no patient skin deformance. And then the scanning can start by lasering the patient at the right spot, marking the patient, either, well, you can do some relative marking, and also adjusting the coil support so that the coil is close to the patient but does not touch the skin. Then hearing protection is put on, and with one push, the system will automatically go to IsoCenter and start scanning. So this is how fast the setup can be. If we look at the couch top, you can also use a dedicated trolley, as you see here, to move patients in. This can be done for patients with difficulties in setting up. You can then prepare outside. You can also use it to quickly switch from diagnostic use to RT imaging by moving the table out and put the diagnostic table in. And it can be used for emergency evacuation procedures, as well as brachytherapy procedures. So the table is designed such that it can hold a 250 kilogram patient, and therefore it's very robust and very easy to use in many cases. The tabletop, as said, was introduced, the Couchtop XD, last year. It has some inherent features that are very relevant for RT procedures. One is that it has a dual indexing system. It has both the 14 centimeter indexing that is available on Elekta and on Varian systems, as well as the Unity indexing, as you can see here, which is every 2 centimeters. So it's compatible with different Linux and with the Unity MR Linux. Secondly, we have built in a possibility to put in the diagnostic head coil on the flat couch top, as you see here. It has a number of advantages. First of all, you can easily switch to diagnostic head imaging on the table without moving, without changing the whole system. Secondly, you can use the QA procedures, which you make use of this phantom, as you see here, can be done in a very quick way. So you don't have to swap coils or tables. And lastly, on the right side, because the patient can be on the base of that coil, that you can integrate it with a mirror so that the patient can look outside and enjoy a certain relaxing video, which is part of our ambient in-bore experience solution. So the integration of this head coil has many advantages, both from a workflow perspective as well as from a patient comfort perspective. Although MR can be used in combination with CT, which is the traditional way that you use MR Sim and CT Sim, actually we are working on a very big program where we move more and more towards MR-only radiotherapy planning. What does it mean? It basically means that you can do a whole procedure without the use of CT. It has many advantages. You can see here on the right upper side that is the normal workflow where you start with MR and CT simulation. You use the images to be registered, and then you do the delineation on MR, the dose calculation using the CT density, and then do the positioning verification using the CT images. What if you could eliminate the CT step? And that's what we do with MR-only radiotherapy workflow. Actually, it is now possible to do a full MR simulation and get similar CT images from the MRI to be used for dose calculation and position verification. And that is the Philips technology is called MRCAT. And we have now 4 areas introduced. We started with MRCAT prostate, including auto-contouring, moved then to MRCAT pelvis, so you get a complete CT-like image of the pelvis. Then we moved to brain using AI technology, and we have now finally also released MRCAT head and neck for the whole head and neck cancers. And also there, the MR produces a full CT-like image. With this approach, you may not need the CT anymore for any simulation in these areas. So this is really making big benefit of the advantages of MR without the overhead of a CT and also the errors related to the registration. We have, for instance, also made a lot of comparisons on patients between the traditional way of CT simulation and then using the simulation with MRCAT. And of course, they should be the same, and you can see in the upper 2 rows that the plans based on MRCAT are identical to those ones planned on CT. The dose differences we've calculated, and we can now say that in more than 95% of the cases, there's no more difference than 1%. So this is really considered to be very good and very close to the original CT-based way of working. This is part of a commissioning step that can be done in the hospital, and we see many customers switching towards MR only and making use of MR-based planning because the results are as good as CT. This year we've also introduced another way to put a mask into the head coil that I've shown you that is compatible with the flat tabletop. What we've done is we've worked together with the company Macromedics to create a mask that exactly fits in this head coil. That has many advantages because now for the first time you can get images that are of diagnostic quality, so with a diagnostic coil, but in a mask. And this is something which, to our knowledge, has not been done before. This produces excellent images, and of course also for the patient it's very comfortable to use the diagnostic coils. Here are some images of the patient in a mask. Excellent 3D T1 weighted and T2 weighted imaging, flare images which usually have some lower signal to noise have great signal to noise in this coil mask combination. So in the end we hope that this combination improves the accuracy of radiotherapy planning, and that also patients, and we see some early signs of that patients are much more comfortable in that, and also it provides better patient outcomes. So this is a new collaboration and combination that can be offered on the platform. Now looking at the MR only, which can, by the way, also be done with the combination of Macromedics and the Philips solution. If we now look at all the MR procedures that are done for radiotherapy, already about 70% or more than 70% are covered by the MR only approach. So you can actually, for more than 70%, take out CT out of the equation. And here on the left side, you see a typical distribution of patients. A lot of prostate is usually done on MR, brain as well, head and neck, and of course some more pelvic examinations. And they typically take more than 70% of the cases. To date, more than 13,000 patients were already scanned with MR-CAT, MR-only simulation, and there are also 21 plus scientific studies on Philips MR-CAT in peer-reviewed journals. If you're interested, please contact us on that. Then moving towards the Unity system. As you see here on the left side, we have the MR-Sim. On the right side, we have the Unity system. And the design of both systems, so the Unity is a treatment machine, is very similar, as you can see here in the images. We've looked together with Elekta very much to this design so that the use of MR in radiotherapy is accelerated. That's actually the vision that we have as Elekta and Philips, that we're both committed to advancing the field of MR in radiation therapy. And by looking at making sure that there is a lot of similarity between the platforms, we hope to better foster that. If we overall look at the synergies between the MR-Sim of Philips and the Elekta Unity, there are a couple of categories which we can discriminate. The first thing is that the workflows are very much the same, and that starts with the indexing system as shown before and patient positioning, which are similar. Also, the user interface is very much alike, and the QA procedures are identical. Then if we look at the images, and this is an important one, the MR system can produce the same images on an MR-Sim as on a Unity. And if these images are the same, it's much easier to do a fully MR-based workflow. You can use contours which are drawn based on MR-Sim and then export it to the Unity, and then you have the same images that you deal with, so you don't have to make adaptations based on different images. That's a big plus of having that combination. The third thing is that we see that many innovations on the MR-Sim will trickle down to the Unity. Examples of those are 3D vein XD, which is a motion-free imaging technique for areas in the abdomen and thorax, DWI, and also compressed sense. They're They've recently been introduced on the Unity, and they were developed on the MRSIM before. Last but not least, also by teaming up in, for instance, training, making sure that the user interface is the same. You as a customer can have fast and efficient learning curves by having the knowledge on one system and apply it to the other system. There are many modules that are the same between these systems. Yeah, and then if you look at the whole workflow, this is something we envision in the future will happen more and more, that MR will take a bigger role in radiation oncology, starting from diagnosis and staging, then moving to the simulation, the MRSIM system, treatment planning then used as a step in between, and then the delivery either on a LINAC or on an MR LINAC, but then, for instance, using the same images as you have on the Unity as on the simulator. And then finally also MR can play a role again in the response assessment to make sure that the patient goes through the right treatment options. So with that vision in mind, I would like to move on to the next subject. It will be MR HIFU and MROR, and that will be presented by Britt Michels.
Thank you, Roman. It's really great to see Philip's strong MR radiotherapy portfolio. I hope you are ready for two more topics on MR-guided therapy, which is MR-guided HIFU in the middle and MROR on the right. We're going to kick off with MR-guided HIFU. This consists of two parts, MR guidance on one side, which is provided by Philips, and HIFU on the other side, provided by one of our partners, Profound. Philips enables and guides HIFU treatment with all benefits from MRI, including excellent tissue contrast to accurately localize the treatment area and include real-time feedback to confidently treat the tissue of interest. And in this way, you can always see what you treat. With this, we're expanding the role of MRI beyond diagnostics only. You can leverage your Philips MR system to be used for treatment in addition to its traditional diagnostic role in a radiology department. So maybe one step back, in case you're wondering, what is HIFU? HIFU is an acronym for High Intensity Focused Ultrasound. This technique bundles ultrasonic waves at one place to heat and ablate an area of interest. In this way, you can treat non-invasively. We can apply HIFU in various clinical areas, but it's mostly used to ablate cancerous tissues. We currently offer MR guidance to two devices to which I'll go in detail. The first is Sonaleaf, treating gynecological oncologies, bone metastases, and soft tissue tumors, and the second is TULSA Pro for treating prostate cancer. So first, let's dive into MR-guided transurethral ultrasound ablation, or TULSA Pro in short. This treats prostate cancer with focused ultrasound from the inside out. The TULSA Pro is a Profound product. The TULSA Pro workflow consists of 3 stages which are guided by MRI. The first phase is to plan the ablation in 3D by visual guidance of MR images. The second phase is get real-time feedback on the temperature of the ablation area. This to control the temperature being in the range of effective ablation but not harming or burning the healthy tissue surrounding the tumor. The third phase is to confirm the ablated area is sufficient to have treated the full tumor. Prostate cancer is the second most frequent malignancy in men, with approximately 2 million new cases a year. Different treatment options are available depending on the severity of the prostate cancer, like MR radiotherapy that we just heard about. This is always a trade-off between removing cancerous tissue and preserving the healthy prostate function. This is why low to intermediate risk prostate cancer is often untreated and placed under surveillance. This is exactly the patient demographic TULSA Pro can treat while preserving healthy functioning. TULSA Pro brings a millimeter precision, personalized treatment, and affected prostate area, an outpatient procedure, and mitigation of side effects for low to intermediate risk prostate cancer patients. And Philips provides the MR guidance to this. The second HIFU device to highlight is Sonaleaf, also a product from Profound. The Sonaleaf workflow consists of 5 stages, of which 4 are MR guided. In the preparation phase, MR imaging confirms the optimal patient positioning for treatment. In the plan phase, the physician schedules the ablation plan based on the MR guidance. In the treatment phase, the real-time feedback controls the temperature being in the range of effective ablation but not harming or burning healthy tissue. The last phase is to confirm the ablated area is sufficient to have treated the full tumor. This treats various types of tumors in women's health, including uterine fibroids, soft tissue tumors, and provides pain relief in bone metastases. Sonaleaf brings precise tumor treatment and rapid pain relief in a fast outpatient procedure for a range of oncology applications. Now I will move to the second topic in MR-guided therapy I want to highlight, which is MROR. MROR combines a surgical theater with an MR room to enable intraoperative MRI during surgery for brain tumor removal. So how can intraoperative MRI improve clinical outcomes? First and foremost, it can evaluate the extent of tumor resection. By visualizing the tumor and normal tissue, intraoperative MRI helps to confirm the successful tumor resection. This guides surgical decision-making and potentially helps to lower the incidence of repeated resection. Also, for pediatric patients, intraoperative MRI can serve as post-operative scan to evaluate the tumor resection, and this reduces the need for repeating anesthesia in pediatrics. Next to that, intraoperative MRI allows the neurosurgeon to compensate for brain shifts due to opening the skull of initial resection. Up-to-date information with intraoperative imaging will guide to make real-time adjustments to the tumor removal process. This supports confident decision-making for neurosurgeons and increases the learning curve for young neurosurgeons as they receive feedback on their procedure while still in the operation room. The operating room and MR scanner can be used fully independent. There's a standalone, fully functional MRI room which can be used for routine diagnostic scanning. In this way, we can ensure that the MR scanner is often used. This increases the cost effectiveness of the MROR scanner in addition to the clinical value of the operating room with an MR system en suite. MROR benefits from all Philips MR system benefits, like Blue Seal and compressed sense, same as what we just heard in MR radiotherapy. These features are utilized in our intraoperative MRI solution as well. With Blue Seal, a fully sealed magnet, helium-free 1.5T MRI is a reality. There's no need to refill and no need for a quench pipe. This allows for easier sighting of the MR scanner next to the operation room. High usage and cost effectiveness are also promoted by the option to connect multiple operation theaters to one MR system. This is possible due to the unique front and rear docking of the table of the scanner. Fast and smooth inline patient transfer of the patient in surgical position can be done in a short transfer time of less than 1 minute. The OR stays intact during the intraoperative use of the MR. There is no need to dismantle surgical setup as the magnet does not enter the OR. So, Philips MROR is an excellent platform for neurosurgical imaging, providing neurosurgeons with the confidence they need for the most accurate brain tumor resection.